If you're a mom, you know your kids will have accidents. They will come home with cuts, scrapes, and other wounds of playground war. And it's up to us as moms to treat those wounds to help them heal. But these days, a Band-Aid and a bottle of peroxide is not going to cut it. So we went searching for something better, something safer. And this morning, as part of our My Parenting series, we've brought in Dr. Cheryl Bongiovanni, a cardiovascular physiologist and wound specialist. She focuses on extreme and life-threatening wounds. And Christy Weeks, a mother of 3, whom I know has seen her share of scraped knees and tears. Good morning to you both.
Good morning.
Thanks for being here.
Well, thank you for having us.
Dr. Cheryl, let's start with you. Obviously, if a child has a wound, God forbid, if a parent can't treat it, of course, the first thing they're going to do is try to, but if for whatever reason they can't, what can happen?
Oh, wounds get infected, and they get massively infected if they are not treated necessarily. There's a whole host of bacteria and fungi and yeasts out there. We also are now all victims, or can become victims, of some of the superbugs, the multi-drug resistant organisms that are now present everywhere, especially in schools, in common use facilities, for example, the gymnasium floor, wrestling mats, shared athletic equipment such as helmets and face guards, even out on natural turf football fields and tennis courts, and any other common use area that you can imagine. For example, buses, trains, subway systems, you name it.
And especially things that we've been hearing about lately in the news, which is MRSA. For viewers out there that don't know what it is, can you explain what it is and who's at risk for that?
Okay, MRSA, that's MRSA, is the acronym for a multi-drug resistant Staphylococcus aureus, or a staph infection. That's something that everybody's heard of.
Sure.
What's unique about this particular organism, or actually nowadays it's a family of organisms, is that it is resistant to most antibiotics. Originally, these things were first identified in hospitals and surgical facilities. Now they are everywhere. We no longer make much of a distinction between a community-acquired MRSA versus a hospital-acquired MRSA. They are profoundly difficult to get rid of once you've got them. They can wreak all kinds of havoc and certainly cause a lot of mischief with adults and children.
And let me tell you, as a mom, I'm always concerned about that. And you, Christy, this is where you come in. I'm sure, you know, you've heard of MRSA, and I'm sure you're always worried about things like that. And I'm sure your kids have had their set of wounds in the past as well.
Absolutely. You know, with 3 kids, you come across just about everything. I have a 10-year-old daughter with no fear, who's involved in sports and very active. And then I have 2 boys who are also involved in your standard issue sports, soccer, basketball, but they're also wrestlers. And so that opens up a whole world of things that you never thought you were going to come in contact with.
So when I was a little girl, the best that my mom did, and God bless her, and it wasn't that bad, you know, the peroxide and the Band-Aid, and, you know, I'm here, everything was fine, but there's better things we can do today, right?
There sure are, and of course when I was a child, we didn't have multi-drug resistant organisms to contend with.
There you go.
So a bottle of peroxide or a bottle of iodine and a Band-Aid were pretty much all that was needed. Not anymore.
So what do you suggest now for moms out there that say, okay, give me something that's better?
Well, the best thing that it is possible for you to have in your home for use on yourselves and on your children is Puracyn. Puracyn is superoxidized water, so it's absolutely non-toxic. It's very safe to use around the eyes, nose, mouth, ears. It's harmless to tissue, but it will kill single-celled organisms within 30 seconds of contact, and that's all of them.
Wow. So you just spray it on the wound, that's it?
You can just spray it on the wound, let it air dry. If it's a more serious situation, say a larger wound, you want to spray it on several times a day and let it air dry. If it's a very big wound, it's very deep, that may require stitches, what you probably want to do is flush out that wound with the Puracyn, and then wet a sterile gauze with it, lay it into that wound, and get your child to the doctor.
Now, Christy, you've used this.
I have.
I've got to tell you, I've never used this, and the first thing I think of as a mom, I'm sure you've seen your children, they go, no, is it going to sting? No. Safe and around the eyes, mouth?
Absolutely. We, you know, nobody likes to feel pain when they're getting treated and the kids back off. No, it's not so bad. This doesn't burn, doesn't sting, it doesn't stain. If they bite their tongue, they have a cut on their tongue, you can rinse their mouth out out with it. It is completely non-toxic, so I'm not worrying about what I'm putting on my children. I use it as a preventative for ringworm with my boys in wrestling. It's just one of those things that gives you a peace of mind. But really, the kids can use it themselves, so I don't have to monitor what they're doing. I don't have to worry about them overdosing or taking too much. And they really have a little more control over it.
And again, to stress that they can spray it on around the eyes and there's no tingling
completely non-toxic, safe to use around the eyes, the ears, the nose, the mouth, and it's just not going to hurt them.
My girls are gymnasts, and I've often worried about the mats that they use. Could I spray it on something to kind of prevent
Absolutely.
a problem?
Any of the shared instruments that they use, the mats, the horse, any of the other athletic equipment, spray it on. Okay, let it air dry. This will render those surfaces sterile. You can also spray the child's hands beforehand, okay, and you will have a residual antibacterial effect.
Any child can use this, any age, there's really no barrier here?
Absolutely no barrier. In our wound clinics, the youngest patient I've ever treated with Puracyn, it was two days old.
Oh, wow.
A little boy with a burn, and the oldest patient that I've treated with Puracyn was 105, and she was a resident of a long-term care facility, got a scratch on her leg, immediately became contaminated with MRSA.
Now, doctor, you treat a lot of patients that are diabetics, and you use Puracyn for them?
Absolutely. Diabetics have several strikes against them, one of which is they are functionally immunosuppressed. Secondly, diabetics who acquire wounds do not heal very well or very rapidly. They are prone to infection, especially in these wounds. Consequently, as it happens, diabetic foot wounds are the single largest cause of amputation here in the United States after trauma. We find that because of the mechanisms of action that Puracyn provides us, we can get these wounds healed where they could not be healed before, not easily. Right now, I believe the national average for healing time of diabetic foot wounds is 6 months.
And with this?
We heal them in about 3 weeks.
What a huge difference.
Absolutely. For the diabetic population, Puracyn is truly a miracle. They just avoid so many complications.
Awesome. Doctor, thank you so much for all that information.
Thank you.
I really appreciate your time, Christy. Thank you
bet.
so much. And this is something that I think I'm going to start putting in my purse every day as well. Thank you. And for viewers at home, if you want to find out more information about this great little bottle that's seriously helping people with cuts, scrapes, burns, and so many other wounds, check out Puracyn.com.